Hi, my name is Michelle Bruno, and this is my week 1 case study for Group Health East and Managerial Principles. What is management? Management is planning, organizing, staffing, controlling, directing, and decision making. And this was taken from the slide presentation that was on the YouTube video. I'd like to go over planning. Mr. Jones, he took recommendations from the board of directors to restructure the incentive program. He also used skills from his previous work and made plans to adjust the organizational design at the facilities to a matrix-based design. He planned to address the increase in hospitalizations, and he also had made plans to adjust the 5-year strategic plan as there was an increase in Medicare and Medicaid patients. In regards to organization, he collected data and information on the prevalence of diseases and risk factors within the population, age, place, and time. He used HEDIS measures as a guide for baseline levels, and he also conducted surveys, including patient satisfaction surveys, short form surveys, and behavioral risk factor surveys. With staffing, he used the industry benchmarks to estimate the practitioner's need for proper staffing in the new matrix design, as there was some concern with the staff. And he then continued to review the data to determine if there is a need to increase the staffing based on the increase in workload. So if there was more patients being seen and the doctors were feeling overwhelmed, it would be a good indication that they needed to increase the staffing. Controlling measures are reviewing the monthly statistics collected at the clinics with the patient data, the amount of patients that had come in, and comparing it with the previous months and also last year's to assess any needs for additional staff. In regards to managerial directing, he created an incentive. There was an incentive system rewarding outcomes of coronary artery bypass graft or CABG. Used research and risk adjustment and provided this information to consumers, providers, and healthcare plans on mortality rates and the risk associated with this procedure, hoping that some education and knowledge would help decrease costs. With decision making, he used decision making each step of the way. Each additional information, every additional information that he received, he was able to add to his decision making. He also started a surveillance system for the hospitalizations, including the preventable measures such as measles, and that's preventable because there are immunizations for those. Also, acute illnesses such as cellulitis and pneumonia. Whereas if they are caught early enough, there should not be a need for hospitalizations for those. And also chronic conditions such as diabetes, whereas if people are well controlled in their diabetes, there really is not much need for hospital usage, as if patients that are uncontrolled tend to use the hospital more and have a higher risk for amputation. Management performance. He used the knowledge of the external environment and using these epidemiology principles, he enhanced his decision making and other managerial principles. Thank you very much.